Okay, and now to finally introduce this evening's speaker, we have Dr. Donald Marsh. Looking back from the 21st century at medical practices in the 18th and 19th century, one gets the impression that the practices and care were barbaric and even brutal, such as amputations, use of maggots and leeches, bleeding patients to rid them of disease, and so on. At the time, these medical practices were considered state-of-the-art medical care and were accepted and promoted as the very best. This presentation will provide insight into the medical practices and care available to our 18th century ancestors. 18th and 19th century ancestors. It will provide a 21st century perspective on these old medical practices and advances they provided for the foundation of many of today's medical techniques like triage, resection of joints, neurological medical practice, and so on. Dr. Marsh received a BS degree in pharmacy from the Philadelphia College of Pharmacy and Science and a Doctor of Pharmacy degree from the Medical College of Virginia, part of Virginia Commonwealth University. Don is a veteran of the U.S. Navy, serving as a sailor during the Vietnam War on a search and rescue team, and later as an officer in the U.S. Navy Medical Service Corps Reserves as a pharmacist. He's a retired clinical professor of pharmacy at the University of North Carolina School of Pharmacy and the University of North Carolina School of Medicine, Chapel Hill. He continues to teach clinical pharmacology online for 3 universities. After retiring, Don received a master's degree in military history from the American Military University and actively pursues his passion for history by researching, collaborating with others, and making presentations, such as the one you'll see tonight. His presentations include a wide variety of topics such as bad decisions by sick commanders, unknown women of the American Revolutionary War, the refeeding syndrome, a little-known tragedy of the Holocaust, comparisons of the largest Union and Confederate hospitals in the American Civil War, and many presentations on current medical topics. And with that, we welcome Dr. Marsh. If you'd like to unmute yourself, and I will stop sharing so you can share.
Okay, I think I'm unmuted. Now
Yes,
let's see if I can get my slides up.
Okay.
And I don't see them. How come I don't see them? Guess I have to do this. Can you see them now?
No.
How about now?
No, you need to click the green share screen button.
Okay,
in
let me
Zoom.
go back and try this again. All right, share screen. And that's not it. That's not it. Oh, come on, I don't see it. There it is. Okay. I think we're cooking now.
Yep. Yep.
Okay, good. I'm going to take myself out of the picture.
Okay.
If I can figure that out. Oh, maybe not. I'll just leave myself in. Okay. Well, the thing is, when it comes to, as Paula said, looking back at the, do you see all this other gobbledygook that's on my slide, or you just see the slide?
Just seeing the slide.
Okay, good. When you look at all the different things that, that they used to treat people with, we say that's barbaric. Well, not really. I mean, again, it's state of the art. Think about it. 100, 150 years from now, they're going to look back and go, my God, 2023, they used to cut people open with knives. Can you believe that? So what we look at the 17th, 18th, 19th centuries as being barbaric, that was state of the art. And that's a very important concept to keep in mind. But this is a very interesting slide where you've got to start here, excuse me, 2000 BC, this root will cure whatever. And then 1000 AD, that root is heathen, say this prayer instead. And then 1700, that prayer is superstition, drink this. And then 1900, that potion is snake oil, swallow these pills. And then 1960, these pills are placebos. They don't do anything. Take an antibiotic, you get immunized. And then 2010, antibiotics are official, immunizations cause autism, eat this root. So we've gone full circle. And believe it or not, we're going to do this in this talk simply because snakes, they used to use every part of the snake back in ancient Egypt, the asp primarily. They used the venom, and they would use that for epilepsy. They use the skin for dermatitis, rub the skin on your skin for dermatitis. And we actually use snakes today. There's a lizard, if you will, in Arizona called the Gila monster. Its bite is venomous and in many cases deadly. We use the Gila monster saliva in a modern day diabetes medication. If you ever heard of exenatide or Byetta, it comes from Gila monster saliva. Now, why do we go after the 18th and 19th century? This graph, I think, kind of shows the timeline here. AD, Anno Domini, you got BC and you got AD. Well, look at modern medicine, 18th to the 21st century. During this entire time, up to about the 18th century, there weren't a whole lot of medical breakthroughs. It was snake root, it was all kinds of herbs and flowering plants and things that were used. So let's look at the 18th century first. One of the first, how do I say this, protagonists when it came to modern medicine was John Brown in Edinburgh, University of Edinburgh, where many Americans went to medical school in the 18th and 19th centuries. They thought European medical schools were so much more advanced than American medical schools. And that was true up until about the time of the Civil War. But John Brown came out with this thesis or theory that there were two types of diseases out there: aesthetic diseases, which were very strong, and aesthetic diseases that were very weak. Now, a strong one would be like typhoid fever, dysentery, measles, mumps. Aesthetic would be like cough, cold, the flu. Not so bad. But what's interesting, regardless if it was strong or weak, there were two treatments. You got stimulants, which were primarily alcohol in nature, and you've got sedatives, which are primarily opium. And you probably heard the term opiate and opioid. Opiate means it's a natural product coming from opium. Opioid would be like fentanyl and Dilaudid and all the other drugs that are out there. And also, one of the things that I have called in Richmond, I've called Channel 12 several times, it is not fentanyl, it is fentanyl with a Y. There is no fentanyl out there, it's fentanyl. But they call it fentanyl all the time, which is very interesting. Now, the other condition, or the other opposing viewpoint, was homeopathy. This was developed by Samuel Hahnemann, who Hahnemann Hospital in Philadelphia was named after. Spent quite a bit of time there when I was in pharmacy school. He originated homeopathy. The treatment there was, instead of giving these heroic, huge doses of medication, you look at the disease, the disorder, and you give them a drug that would cause the same symptoms as of the disorder. In other words, if somebody's having a seizure and they're sweating, you give them something that would make the patient sweat. And you give them in very minute doses. And his theory was you give them a little bit of a dose of medication, the body kicks in, and it's kind of like the immune response that we see today. But the body would kick in and the body would actually heal itself. And that was true to a certain point, but homeopathy is still alive and well out there. It became a very popular view in the mid-19th century, but it originated in the 18th century. Then in 1761 was this fantastic article written by Morgagni, I can't even pronounce his name, Morgagni in Padua, Italy. And basically it was the seats and causes of diseases investigated by anatomy. He and his colleagues were able to examine 700 bodies and found pathologically what killed these people. And he was actually able to match what caused the death to the clinical picture in life. They didn't have smoking back in the 1700s. It's not like they have today. But he did find some respiratory pulmonology changes when it came to not so much cigarettes as cigars and pipes. Now, surgeons and physicians. Surgeons is a really loose term. Everyone was considered a surgeon as soon as they became a physician. The training, if they were rich, was 1 year of classroom work, 1 to 2 years as an apprentice. And believe it or not, in the 18th and 19th century, all you had to do was stay at home, read books, and then take the exam, and you became a physician. You didn't even have to touch a patient. And this kind of backfired when we got to the American Civil War, where individuals were called upon to do amputations. They hadn't even carved a chicken in their life, let alone take off somebody's arm or leg or foot or hand. The experience that they used was primarily writing prescriptions for botanicals. And they believed that everything that grew on the earth would cure every disease out there. You know, that was God's way of protecting human beings. If you want an advancement in medicine, you've got to have a war. Every single war since about the early 1800s has brought medical advances. Case in point, individuals wounded in the Vietnam War, if they got to a chopper, they had a 75% or so chance of survival. The global war on terrorism, if they were able to get to a chopper and get to a medical facility, their survival rate was 94%. Obviously, during the Civil War, they didn't have helicopters, and the death rate was very high. Matter of fact, most references point to about 600,000 soldiers and sailors dying during the Civil War. It's probably close to 1.2 million. The records were very, very poor on the Union side, and they were burned up in the Richmond fire on the Confederate side. But more than 1 million people died in the Civil War. Now, American Revolution, 3,500 medical practitioners. Now, there were 200 of them that actually had some medical training. The rest of them were just, hey, I'm not going to fight on the front lines. I'm a doctor. And they go, okay, fine. Now go take off this man's foot. Apprenticeships were quite common, especially in the rural areas where individuals would go and apprentice with a local physician and learn how to treat different diseases and things. Very little surgery, very little surgery. 1,200 of these 3,500 medical practitioners served in the Continental Army or the Continental Navy. Two very influential medical practitioners that were in the war, Major General Joseph Warren, who was in Boston, and Brigadier General Hugh Mercer from Fredericksburg, Virginia, who was a pharmacist. Joseph Warren was a physician, Hugh Mercer was a pharmacist. What's interesting is Joseph Warren was an outspoken patriot, was killed at the Battle of Bunker Hill. Hugh Mercer, who played a dramatic role in the Battle of Trenton in Christmas 1776, died a month later at the Battle of Princeton. So they were both generals, they were both healthcare practitioners, and they both died in the American Revolution. What they did not realize at that time, and this was a very common practice all the way up to the American Revolution, anybody that was sick, anybody that was wounded, you stuck in a hospital. These folks were piled on top of each other, basically, with maybe straw underneath them as a mattress, if you will. The personnel were untrained. They were very ignorant of any diseases that were out there. So let's talk about nurses. There was absolutely no formal training. And you've probably heard of Florence Nightingale and her lamp. The lamp is the symbol of nursing, just like the mortar and pestle is the symbol of pharmacy, and the caduceus is the symbol for medicine. No formal training. American Revolution, they actually appointed 7 women and 30 nurses to work in a hospital, to work in the military hospital, 7 of them. And they were all located in the large cities, Boston, Philadelphia, New York City, and Charleston, South Carolina. Now, the thing about that is they weren't paid that much. Washington actually felt, and Nathaniel Gates, another Revolutionary War American general, said, well, you've got women that treat people at home. They treat their families at home when they're sick. Why don't we bring them into the service? So they were brought in, and they actually replaced what were called surgeons' mates. and hospital stewards. And they served very, very well. The records show they cared for over 4,000 men. They were assisted by military wives and laundresses. As a matter of fact, two famous military wives that were nurses, Martha Washington and Lucy Fluker Knox, who was married to Henry Knox, the bookseller who was from Boston and was Washington's right-hand man, and Fort Knox is named after him. After the war was over, patient care went back to regimental surgeons, physicians, and surgeons' mates. Women were told to go back home. Then we have pharmacists. The drugs back at this time were not proprietary like we have today. There were no real pills to speak of. There were pills, but you had to make them. Everything was compounded, everything. And that's why you look at some of these pharmacies like the ones they've got at the Smithsonian Institution. They've got huge numbers of botanicals. That's because everything was compounded. There were no drugs to just hand out, to count out and hand out. You had to make capsules, you had to make pills on a pill machine. So it was a very tedious process. It took a very long time to fill these medications. So what kind of diseases were seen in 1700s America? Typhoid fever, caused by an organism called Salmonella typhi. Now, typhoid fever and typhus are two separate entities. They are not the same thing. Typhoid fever is a condition, excuse me, where they would have high fevers. They would sweat just tons and tons of sweat, and they also would have some diarrhea. Now, if it became bloody, it was now dysentery. Dysentery is very, very bad. Typhoid fever is not so great either. And I will talk, somebody asked about the treatment for typhoid fever in the 1890s. I'll get to that when we get up to the 1890s, so please hold that thought. But high fever, headaches, stomach cramping and pain, and some diarrhea, usually not bloody. Why did people die of typhoid fever? They died of dehydration. They lost fluid by vomiting. They also lost fluid through their stool, this chronic diarrhea, and they died. Dysentery is bloody diarrhea. Very, very nasty and quite deadly. And these come about with being in close proximity with people. Somebody's lying next to somebody with typhoid fever, they're going to catch it. It's very, very contagious. Dysentery came from all kinds of things, not only food, but it also came from exposure to animals and some other things. Now, malaria was an interesting one in that they didn't know about mosquitoes back then. I mean, they knew they could get bit by mosquitoes, but they didn't put mosquitoes and disease together. Malaria was called a miasma. It was caused by bad air. And where did they get the bad air? Well, if you were in a swamp, that's bad air. Many times you got malaria because you got bit by mosquitoes in the swamps. So you had this thinking of bad air, which led to the thinking of we've got bad blood. And if you get rid of the bad blood, the disease will go away. So they bled you. Talk about that in a minute. Smallpox. Smallpox is caused by a virus, variola virus, extremely contagious, extremely deadly. Practically everyone back in colonial America was exposed to smallpox. Matter of fact, Thomas Jefferson, if you lowered Thomas Jefferson's collar, he had smallpox scars on the back of his neck when he had it as a teenager. Scurvy, primarily seen in those with vitamin C deficiency. They're not taking in enough vitamin C. The first sign that you've got scurvy, your gums are bleeding and your teeth start falling out. So easily corrected with portions of vitamin C. That is why the British Navy gave oranges and limes to their sailors. That's why they're called limeys, because they had limes which contained vitamin C, and it would prevent them from coming down with scurvy. Puerperal sepsis. This was a major killer of women, also called childbed fever. Folks back then didn't wash their hands. The physicians didn't wash their hands. The midwives didn't wash their hands. So they were handling these babies and handling the vaginal area with dirty hands. And purple sepsis, they got infected. It became a septicemia, blood poisoning, and very, very deadly, very deadly. Not so much yellow fever at that time. Yellow fever became a little more prominent in the early 1800s. Yellow fever is caused by a parasite and can be spread by mosquitoes, which, again, we'll talk about when we get to Walter Reed talking about yellow fever and the Panama Canal construction. But yellow fever was another one. The reason they call it yellow fever is because the skin turns this yellow-orange color. And when it does that, again, you run high fever, dehydration, and your body just wears itself out. Now, this is a picture of typhus. Typhus is basically, lack of a better term, lice. And this picture was taken in 1945 in a Holocaust survivor in one of the camps. And this actually is the sleeve of her arm. This is her arm, and this is a sleeve. And it's hard to get rid of these things. Matter of fact, during the American Civil War, lice got so bad, even Robert E. Lee had lice, and U.S. Grant had lice. They would take off their clothes, shake them real hard, or hold them over a fire trying to kill these things, which in many cases it did. But after a while, they got tired of doing that. What they would do is turn their clothes inside out and wear them inside out for a few days until the lice got through them. Then they take the clothes off and put them on right side out again. Interesting. But again, typhus, you've got bleeding into the skin, what we call petechiae, sometimes delirious. You just can't stop scratching, itch all the time. Low blood pressure, chills, fever, headache. Going back to, I'll mention this later too, going back to yellow fever, there were some major yellow fever epidemics in Virginia in the 1800s. In 1855, there was a yellow fever epidemic in Norfolk. It killed 33% of the adult population. 1/3 of the adult population of Norfolk died in 1855 from yellow fever. Came in from a ship, came in from the Caribbean. Now, the drugs used are drugs that have been used for hundreds, if not thousands of years. Cinchona bark, quinine. At that time, it came from Peru. Washington was not a state at that time. Washington State, the great Northwest, is where cinchona bark grows. They had a drug called blue mass, which was used all the way up to the time of the Civil War. It was mercury mixed with opium. And they used it for everything. They used it for constipation. They used it for diarrhea. They used it for coughs and colds. They used it for rheumatism, everything under the sun. Calomel is almost pure mercury. And calomel killed a lot of people. Mercury is not a good one to take in. It will wipe out your kidneys. Creosote, like what you have in your chimneys when you're burning wood, they use creosote as a cough remedy mixed in water. That'd taste absolutely awful if you think about it. But here they are scraping the inside of chimneys to get creosote to break down, stop their coughing. Ether really came about in the 19th century, so I'll skip that. Chloroform was right at the turn of the century, the 1700s to 1800s. Obviously, these two are used as anesthetics. Silver nitrate was a caustic, and still is, a caustic agent. They would use that to close wounds, to stop nosebleeds, and it really burns, really, really burns. Opium and morphine we'll talk about later. Acetic acid, also known as carbolic acid, was used as an antiseptic. All of us know about castor oil. We don't have to talk about castor oil. You know exactly what that was used for. Turpentine. Turpentine was used for coughs. It was used for all kinds of different skin conditions. And believe it or not, it was one of the best remedies for psoriasis. And today, one of the best remedies for psoriasis is petroleum products, motor oil. I made fun of my dad putting motor oil on his psoriasis until I read about it in pharmacy school. And I thought, wow, he came about with that on his own. But yeah, motor oil, it's really good. Turpentine, you may remember an old preparation called elixir turpentine hydrate with codeine. It's off the market, but ETHC was used for coughs, was very effective. Tasted god-awful, but it was basically turpentine. ETHC, elixir turpentine hydrate with codeine. Digitalis, been around since the 1700s, 1767. Sir William Withereen wrote a paper on digitalis used for dropsy or heart failure. And Dig in some form is still used today, primarily digoxin rather than digitalis. Hydrochloric acid was used again as an antiseptic. Ammonia, spirits of ammonia were used to rouse someone that was unconscious. Potassium iodide is still used today. It's used as a cough preparation. Whiskey and brandy, you probably have never heard of these, but they're alcoholic beverages. And again, we still use those today. Many of these drugs were mixed with whiskey or brandy, some kind of alcohol, to first solubilize them, and second of all, for somebody to actually be able to drink it. One of the biggest businesses in the 16th, 17th, and 18th century was bloodletting. And what they would do, you may not know this, but the barber's pole, it originated in the Middle Ages. You may have heard this, maybe not. Barbers at that time were also considered surgeons. So if you want to get operated on for something, there may not be a physician around. You went to a barber. I don't know about you, I wouldn't have my barber do more than cut my hair. I'm a little afraid she'd bleed me out or something. But they would do tooth pulling, tooth extractions, bloodletting, and minor surgery. So they had a wooden pole with a basin on the top and a basin on the bottom. On the top, they had leeches. The bottom was used for blood collection. What they believed at that time was bad air caused bad humors in the blood. And to get rid of the bad humors, you bled them. George Washington died in December of 1799. Guess what he died of? Bloodletting. They bled him out. They bled him out. So anyway, they had leeches up here, and the pole represents the red, bloodletting. And the blue, they would actually hold this pole while their blood was, while they were cut with a scarificator or a knife, and the blood would flow down the pole into the basin at the bottom. That's where the red stripe comes from, blood. So next time you see a barber, ask them, hey, when's the last time you did any bloodletting? There were some nasty things. This thing is called a, well, the bleeding bowls were used there, but this is called the artificial leech. And what they did is they took this thing, put it on the skin, and they rotated it, and it would act like a leech and rip a hole in your skin and into your vein, not an artery, but a vein, and you would bleed 20 cc's, 50 cc's. It really depended on what the condition was. And these are the different items, blades that they used. And this is a blood bowl where they would collect it. And it was very common all the way up to the 1860s to drain it. Another way of bloodletting was using leeches. When I was in Philadelphia, there was a pharmacy called Houseman's. It's still there. It's been there since the 1750s. They still sell leeches. You can go in and buy leeches. They used leeches in the old days for everything, again, to get rid of the bad blood. What they sell leeches for today, they put them on, patients put them on their temples, and it makes headaches go away. I'm not so sure about that. I had quite a few leeches on my body when I was in Southeast Asia, and they are nasty things, nasty, nasty things. But leeches were very, very big business. They're still used today. Like I said, they're used for headaches. They're also used in vascular surgery. If someone loses a finger or loses a hand, when it's reattached, they put leeches, sterile leeches on there to suck the blood, to pull the blood back into the reattached hand or reattached fingers. So we still use leeches today, although they're sterile. Now, Benjamin Franklin, brilliant guy, wrote a book in 1736. It was called Every Man's His Own Doctor, or the Poor Planter's Physician. And basically this was a cookbook, if you will, for people to treat diseases and minor disorders at home. Wives and mothers would use this. It recommended drugs or botanicals being used, such as the poppy for pain, wormwood, sage, digitalis, or foxglove, mint, lavender. These would cure several ailments, such as headaches, dropsy, stomach pains. Mint, we actually put mint in things today, which helps with stomach pain. Just like ginger root, very effective for stomach ailments. Again, there were some pills available, but most of the time they had to be, well, all the time they had to be compounded, and most of the time there were powders. You mixed them with water, they were tasted terrible. That was the way medication was given. Now this is interesting. The first successful appendectomy was during the 18th century. Before that, they really didn't know what was going on, and they would try to treat them with herbs and things. It didn't work. Also in the 18th century, you had vaccinations. Now everybody talks about Jenner and the first vaccinations. There was a woman 60 years before him, Lady Mary Wortley Montagu, who wrote a small book on this. And she was very, very active in giving vaccinations. And Jenner picked up on that. He saw a milkmaid that had been exposed to smallpox, and she broke out with a rash, but it wasn't a smallpox rash. She broke out with cowpox, which is an extremely mild form of variola. So what he did then, he took this young lady and he inoculated her with smallpox, and she agreed to it. She didn't develop the disease. So he started using cowpox to make smallpox vaccinations and inoculations. And so it basically was eradicated. Matter of fact, the last case of smallpox reported in the United States was 1978. It's become few and far between. There was a resurgence of smallpox a couple years ago, but apparently that was nipped in the bud. The first actual hospital in America was Pennsylvania Hospital in Philadelphia, established in 1751, and one of the founders, Benjamin Franklin. Now, also a prominent physician in Philadelphia was Benjamin Rush. He was not only a physician, he also did a lot of painting, but he's more well known for his medical expertise. He founded the University of Pennsylvania Hospital. He also founded the neurological hospital in Philadelphia. He was very interested in neurology, which at that time was really, really basic things. So looking at 19th century medicine, basically it was male dominated. Women were not allowed to go to medical school. And the only way they could become doctors is, again, through an apprenticeship or study on their own. That's the only thing they could do. Training, basically in the 18th century, was just like that prior to the 18th century. Apprenticeships, formal schooling if they had the money, and there was a large medical center in their city. Physicians at that time made house calls to give care and dispense medication, and medical schools became much more common, although the older, more established European medical schools still were by far where people went to medical school. But the big centers at that time, Philadelphia, New York, and Boston. Very few women practiced medicine publicly. They did behind the scenes. One thing that women did do was midwifery, because physicians would not come out with a birth. They would leave that up to one of the women in the neighborhood. So midwives, women helping other women during childbirth, very, very common at that time. Okay, then between 1800 and 1860, they had what were called bone bills that were passed. They were on anatomy. They were based on anatomy. One Massachusetts bill allowed medical schools to basically buy bodies. And it was quite a lucrative business. These grave robbers, for lack of a better term, would go out to a fresh grave, dig up the body, and sell it to the medical school after cleaning it up. So they also would take bodies of people that didn't have money for burial, those that worked in workhouses or those in hospitals, no money. So basically that's where they would take a body and go to the medical school and try to get some money for it. As the number of medical schools grew, the number of, or the demand for bodies grew, obviously. So the anatomy laws didn't really advance medical practice. It did increase grave robbing, and that went all the way up to the time of the Civil War, because as I said, over 1 million casualties. They had a lot of bodies to use. They didn't have to worry about grave robbers anymore. So let's talk a little bit about how probably the most important medical instrument at that time, and still important today, developed. It was the stethoscope. Leopold Ellenberger in Vienna, Austria, developed this, which was the first real stethoscope. And the way he came about with this, his father owned a tavern. And as a boy, he would go down and thump on the casks to find out how full the cask was with beer or any other whiskey or any other kind of liquor that they had, schnapps. And he realized the more hollow the sound, the more empty the barrel was. And he applied that to his patients. So he's credited with really the first real stethoscope. The one that really expanded on that was René Laennec, French. He developed what we would call the modern stethoscope. He started out with rolled up paper, and he would listen to his chest or listen to a carotid artery. And he actually made this. This is in one of the Paris museums, but this really was the first stethoscope. And then Kamen came out with the binaural stethoscope. Now, what's interesting about this, the binaural stethoscope, the thinking was, if you had it in both ears, one ear would make the other ear sound funny, so it wouldn't work. Well, obviously, the binaural stethoscope caught on, and that's basically what we have today. I haven't seen anybody use the Ellenberger stethoscope. Everybody uses the Kamen type stethoscope, or today, the Littmann stethoscope, probably the most common brand that's out there. So let's talk about surgery. The first documented successful surgery was by Ephraim McDowell in Kentucky in 1809. He took out a 25-pound ovarian tumor from a woman, no anesthesia. They didn't have anesthesia at that time. They gave her a whole lot of whiskey. That's all they had. They didn't have ether or chloroform. 25-pound ovarian tumor, and the patient survived. Then William Morton, American dentist, probably the first one to actually use ether. And it was in 1846, and it caught on like wildfire. And just before this was the use of chloroform. Now, at the same time, just prior to the Civil War, in 1854, Louis Pasteur in France developed his germ theory. He found that by doing pasteurization, you killed bacteria by heating milk to a certain temperature. He also found fermented wine heated to a certain temperature killed organisms. And he found that some organisms use oxygen. They're called aerobic organisms. And he found some that did not use oxygen, anaerobic organisms. Anaerobic organisms like this, probably the one that's the worst that I've ever seen is Bacteroides fragilis, or Bacteroides gangrenosum, gangrene. They don't need oxygen, and they smell to high heaven. I can tell you in the Southeast Asian jungles, you could smell someone that had gangrene, and you could be several yards away. It was that profound. I freaked out when I did my residency at Thomas Jefferson University Hospital in Philadelphia. I freaked out one of the attendings when I walked on the floor as a pharmacist. I walked on the floor and said, somebody on this ward has gangrene. He turned around, looked at me, and goes, how do you know that? I said, you can smell it. It smells like cheese. It smells like bad cheese. And he was pretty impressed. Never bought me dinner or anything, but he was pretty impressed. Anyway, Pasteur went on to propose that if you could purify substances, then you could also purify the body. And he really started to come up with the thinking along the lines of developing antibiotics. Well, Joseph Lister took this a step further. He used carbolic acid spray, acetic acid spray, and he insisted that all instruments and physicians' hands be washed with carbolic acid. It's really rough on the hands. They didn't use the 3% acetic acid that you see today. They were using like 20%. And it was really rough on the hands. And a lot of physicians got kind of poo-pooed him. Well, his theories caught on. That's one reason we have Listerine mouthwash today. Came from Joseph Lister, Listerine. He really revolutionized medicine. And had he been about 2 decades earlier, there would have been a lot less deaths in the American Civil War. At that time, in the 1850s, they started to come out with proprietary medication. And proprietary medication means that they were made in pharmaceutical houses and then sent to pharmacies to be sold. So here's a couple of them. Lydia Pinkham's. As a pharmacy student in the 1960s, we had this in our pharmacy, Lydia Pinkham's. It was for constipation. It was for any ill that women have. And basically that's what the old label said, for women's ills. I'll show you another label later. And then we had Dr. McAllister's cough mixture. This stuff was great. Look at the ingredients: cannabis, chloroform, and alcohol. I'd say that's pretty darn good. That should just about cure anything. And if it doesn't cure, you don't care. It's good stuff. Obviously, it's off the market because you can't sell this stuff. By the way, this was 10% alcohol. That's a pretty good slug. Chloroform too, and cannabis too. Now, when it comes to cannabis, it's not new. It's not a 1960s thing. Cannabis has been around since probably 2000 BC. The Chinese had it back at least by 1200 BC. Napoleon brought back cannabis from Egypt when he was doing his Egyptian campaigns, brought it back to France, right through Marseille. And guess what one of the drug capitals of the world is? Marseille, France. Ramses II, in his tomb, they actually found cannabis. The Arabs used it to treat epilepsy, and if you use a high enough dose, you will stop an epileptic attack. Cannabis has been around a long time. Here's one I found in my research. First of all, the biggest grower of colonial American cannabis, George Washington. Mount Vernon had a whole lot of acreage of cannabis growing. And he said in his diary that he was using it to make rope. He didn't say what he did with the rope after he made it. I think he was smoking some because he did not have wooden teeth. He had sheep's teeth. And those teeth, if you go to Mount Vernon and see them, they look nasty. I can't imagine them being in my mouth. But he did use some of his finer product. Now, here's another one that you may not know. There was more marijuana smoked during the American Civil War than during the Vietnam War. And when you think about it, these guys would charge into the mouth of a cannon, shoulder to shoulder. They were either incredibly brave, incredibly crazy, or high. Probably a mixture of all three. But cannabis was extremely popular during the Civil War. Not something you read in the history books, but the information is there. If you go and read the the medical and surgical history of the War of the Rebellion, it's rampant with discussions of cannabis. Now let's talk about the Civil War. I'm concentrating primarily on American advances, although a lot of them came from Europe, because otherwise we'd be here all night. They started what was called triage. And the first real triage that was done in the Civil War was done at the Battle of Shiloh in April of 1862. A physician would be designated to look at casualties coming into the area and determine how bad the wound was, if the wound was treatable, if the patient would be able to survive surgery, let alone the wound. And they would line up men off to the side that they just kind of, there's no way, we can't do anything. Head wounds, chest wounds, usually they got put to the side and were left to die. Other wounds of the limbs, they would go ahead and treat. Abdominal wounds, it really depended how deep the wound was. But this was triage, where they would sort out who could make it and who couldn't. And they got very, very good at it on both sides of both armies, North and South. Now, I talked about chloroform. This is a chloroform cone. And what they did is they put this cone over the patient's face. They put a wad of cotton in the top of the cone, and they would pour the liquid chloroform. So patient basically was drowning and would be thrashing around. So there'd be men standing around holding the patient down. And then someone would hold the arm or leg or hand or whatever. And then the physician would start cutting with a knife, cut through the flesh, and then take the bone and cut through the bone. Chloroform was very effective. One of the fallacies of the Civil War is there wasn't enough anesthetic and people were biting bullets and things. Totally Hollywood, totally false. Medical and surgical history of the War of the Rebellion, there are many cases where Confederate surgeons and Union surgeons would meet the night before a battle in the middle of the battlefield, soon to be battlefield, and they would make sure they had enough medical supplies on both sides to treat the wounded. There is no report coming from the field. If there was chloroform available, they got chloroform. Ether was used in the hospitals. Ether is very, very explosive. They had gas lanterns or open lanterns burning fuel and whale oil as an example. They didn't want ether around because there were explosions. But on the battlefield, field hospitals, advanced hospitals, they used chloroform. There was never a shortage. One of the big Hollywood fallacies. There was plenty of anesthetic to go around. All three were Union physicians, and all three were actually practiced right down the street where I went to school, Philadelphia College of Pharmacy and Science, the very first pharmacy school in the United States. Jonathan Letterman was Surgeon General of the U.S. Army and actually was the one that commissioned the publication of the medical and surgical history of the War of the Rebellion. He was instrumental in getting rid of calomel. Calomel was given to everybody for everything. And the problem with calomel is it's almost pure mercury and killed more people than bullets. Silas Weir Mitchell, father of neurology, and he actually took Benjamin Rush's neurology hospital and expanded it and built quite a name for himself in the decades after the Civil War with neurology. And then the father of plastic surgery. He's been around a long time. I didn't mean to do that. They had to do plastic surgery because of the horrific wounds of the war. This is the medical and surgical history of the War of the Rebellion I was telling you about. There's quite a few volumes. It makes for very interesting reading. It would put my wife to sleep, and she's a nurse, but I would get enthralled. I'd read till all hours of the morning, this stuff. Now, if you look at the tools the surgeons used, and you have to remember at the beginning of the war, many of them were rural physicians that got pulled into the army, and the closest thing they got to surgery was probably taking ticks out or taking leeches off or chiggers, getting rid of chiggers. They really didn't do amputations very often. Usually they sent them to the larger hospitals for that. And all of a sudden you've got somebody thrown into a situation where they've got hundreds of wounded waiting, and they've got these tools. So they became proficient by trial and error with amputation. And a good surgeon at the end of the war, either side, could take off a limb in 3 minutes. That was the average, 3 minutes. But these are the tools they use. These are, to us, they're archaic and barbaric. But again, at that time, it was state of the art. But this is why they did amputations. This is a clean-cut femur. So obviously, as clean a cut that is, it's an amputation. But look at this wound right here. Okay, I don't know why that's popping up. Oh, I lost it. Hold on, let me see if I can get back. Where was it? My apologies. I don't know what happened. Okay. The bullet they used was a 58 caliber lead bullet, which softened as it flew through the air. It was a slow velocity bullet. So instead of going through clean, it would do this. It would shatter a bone. And when it shattered a bone, the only thing left was amputation. So that's why there were so many amputations. Now, there's still an ongoing raging controversy. Were there too many amputations during the war? Were there too few amputations? It really was probably a mixture of both. There were probably not enough in some cases, too many in others. Now, this is a totally fanciful Union field hospital. Why? First of all, the surgeon's operating on somebody. Nobody's up here to give more chloroform if the patient needs it. Second of all, they're allowing him to thrash around. There would be aides holding the patient down while the surgeon dug for the bullet or the shrapnel or whatever. So this is kind of fanciful. But this gives you the idea of what kind of surgery was done. And they would throw whatever body parts they amputated or bullets, what have you, usually into a bowl or down into a bucket, and then the bucket emptied. I don't know if you saw anything about this. Last year at Gettysburg, they're always finding things at Gettysburg. They were laying a power line. It was right near the, oh gosh, what was his name? Jacob? Oh, it'll come to me. His farm. And this man's farm was used as a field hospital. And what they did was, as they were digging, they found a pit, and it was full of the skeletal remains of hands, feet, fingers, arms, legs. It was one of the pits that they had dug and were throwing all the body parts in, and nobody knew the pit was there. And obviously it horrified the power line people that were digging the power line. Biggest Hollywood myth out there, biting the bullet. Nobody bit the bullet. There is no record of anybody biting the bullet. They would bite on wood, if anything, but not a bullet. It's not real healthy. Second of all, you do not leave teeth indentations. There was a study done at Cornell University, and they said that for a human to leave teeth marks in a Civil War bullet, you had to have strength in your jaw about 20 times what a normal human being has. So the question comes up, what are all these bite marks? Well, back then, they didn't bury the bodies very deep. Animals got to it. Animals would chew on things like bone and bullets and shrapnel. So these are animal bites, not human bites. But it is definitely a Hollywood myth. Biting the bullet didn't happen. A lucrative business started after the Civil War. There were several people that, matter of fact, one guy that actually formed a prosthetic company is still in business today. He formed it after the Civil War. He lost an arm, or I'm sorry, a leg at the Battle of Shiloh, and was sent home because obviously he couldn't serve in the army anymore. And he developed a prosthetic company and sold thousands of prosthetic devices. Now, the thing is, a shoulder wound like this, there was a good chance of survival. Leg wounds were much worse because, again, you've got bigger arteries and veins in the legs. A wound like this, above the knee, about halfway up the thigh, about a 50% chance of dying. There's a good chance of dying. Records show that if they could get to a table and get operated on, they had a really good chance of survival, better than 50-50. But the longer it went, their chances of survival were much less. Records show that about 25% of the amputees died later. At that time, they believed in a process called laudable pus. They would allow pus to be formed in the wound, and they thought that was a good thing. Well, today we know it's a bad thing. It didn't drain the pus, and the pus full of bacteria caused blood poisoning, septicemia, and the patient died. And it didn't take long after the war for them to figure that out. But during the war, they thought the pus was a good sign. It's not. Camp diseases, diarrhea and dysentery, very common. The food they ate was terrible. Hardtack and fatback and bacon. Measles, very, very contagious. And you have to remember, a lot of these men were from rural areas. They didn't have the disease exposure that city boys would have. So simple things like measles, chickenpox, mumps would kill them. They died in very high numbers in training camps. Malaria, mostly in farther south, although down around Dismal Swamp, there's malaria. Tuberculosis, very, very common. Pneumonia was a major killer. Typhoid fever, which I already talked about, very, very contagious. And then other camp fevers, different miasmas and what they call intermittent or periodic fevers, which there is no idea of what causes it. They came out with a pavilion-style hospital, and Chimborazo Hospital in Richmond, the largest Confederate hospital, if not the largest hospital in the world at that time, was a pavilion-style hospital. They separated the beds. They made sure that there was a nurse for every 3 to 4 patients. They made sure there was a lot of ventilation and air circulation, and improvements like this in structure vastly improved survival. And the pavilion hospital is still used, concept is still used today. Came out of the Civil War. Nurses, again, were ladies that volunteered with no formal training, served in Union and Confederate sides. Ladies' Aid Society of Richmond had a lot of nurses. Phoebe Yates Pember, her husband died of tuberculosis in Charleston. So as a widow, she moved to Richmond, became the chief matron at Chimborazo Hospital, wrote a fantastic book about her experiences at Chimborazo. And when the Union forces came into Richmond in April of 1865, they kept her on as the chief matron at Chimborazo because she knew everything that was going on. She knew where all the skeletons were buried. She was very, very useful to the Union forces. At Satterlee Hospital, which I didn't know it at the time, sat right next to where I went to pharmacy school. Satterlee was the largest Union hospital, and the Sisters of Charity are the ones that nursed Union soldiers there. They were very, very good at their job, very, very good. Interesting thing about Satterlee, it was built as a pavilion-style hospital. It was built as a permanent hospital. After the war, they ripped it down because it was prime Philadelphia land. Chimborazo was built as a temporary hospital. Chimborazo remained standing until 1903. War ended in 1865. They used it as apartment buildings. They used it as a classroom, different types of classrooms. But it's interesting, the one that they were going to rip down stayed up. The one they were going to leave up went down. Economics. Then we have the pharmacists. I would get thrown out of the profession if I didn't talk about pharmacists. Typically, it was what they called a hospital steward. He'd do an apprenticeship under a pharmacist. And at that time, they started to have a whole lot more proprietary medication made up in pill form already. Pyrizodel, Pyriza is coughing. So it's a pill for treating coughs. Quinine was used for everything, quinine sulfate. Mortar and pestle, which is the sign of our profession. And again, this is what they would travel with in the field. And they would just make these preparations up as they needed them. Now, another myth, the Union blockade. If you read about the blockade, nothing got through. The South starved. Baloney. Records show 70 to 80% of all the blockade runners got through. And they carried drugs. And they carried weapons. Unfortunately, toward the end of the war, the success rate was still very good, but the captains of the blockade runners realized they made a lot more money carrying French perfume and silk than carrying weapons or drugs. So that's why it was difficult to get the drugs through the blockade. But it was successful. Well, here you have chloroform. which was very, very common, made by a druggist, Georgetown, Washington, D.C. And then you've got opium. Now, this is great. Look at this bottle of opium. Contains 46% alcohol, 3 grains of opium per ounce. That'll do it. Relief of headache, pain, cramping. I can't even read that one. And women's discomforts, which was everything under the sun. I mentioned calomel. Calomel is mercury chloride, mercurous chloride. And they use this for everything, like typhoid fever. And it's in the medical records, it says that Jonathan Letterman came out and said, calomel killed more soldiers than bullets, and finally had the drug banned. So 19th century medical improvements, I've gone through some of those, proprietary medication, medical instruments, but again, it always takes a war to have those kinds of improvements. Toward the end of the century, other medical advances, Walter Reed developed a vaccination for yellow fever. That was during the Panama Canal construction under Teddy Roosevelt. Conrad Röntgen developed the X-ray machine, and Pierre Marie Curie discovered radium, which was used in the X-ray machine. And of course, we got Freud in 1895 that wrote his book on psychoanalysis. I can't be complete until I talk about the 1880s, 1890s quack medicine. Quackery is a Dutch word, quacksalver, referring to someone who uses home remedies and false knowledge with the aim to cure. Exploitation of medical ignorance was extensive during the 19th century. Again, they aimed it toward women. Many women were not allowed to go to school for any length of time. They weren't allowed to graduate high school, let alone go to college. And they aimed it at these folks. They always went after women's ills, the fairer sex, if you will. Medical inventors, it was their job to convince the public that a medicinal, which contained mostly alcohol, could treat any disorder and leave them on a medical high. Basically, it was water or alcohol based. It did nothing, but maybe gave them a placebo effect, made them feel good. This is an example. Faricum is for the cure of diphtheria, sore throat, croup, catarrh. And if you look down here, it's basically water and alcohol, but it's good for everything. And then here's a bunch. I like this one. Dr. J.W. Bull's cough syrup, taken for children without purging. It's very effective, contained cocaine. And then Lydia Pinkham's, I talked about that. Here's a social tragedy. Women who braved death for social honors. If they took Lydia Pinkham's pills, they would get over whatever was going on with them. And then cocaine tooth powder, cocaine toothache drops, great stuff. And then back then in the 1890s, well, 1880s, women wanted to lose weight, keep their hourglass figure, so they would swallow tapeworm eggs in a capsule. The tapeworm would grow in the GI tract and would ingest some of the food that the woman would eat. They would grow to 30 feet long. There's one on record that was 36 feet long, and 4 inches of it came out of the patient's rectum. I don't know about you. That doesn't sound too, I'd rather be fat, to tell you the truth. Anyway, it grows in the gut, ingests some of the eaten food, can grow up to 30 feet long. There's 36 feet of intestine. And sometimes if a physician or someone looked in the patient's mouth, they could see the head of the tapeworm just beyond the epiglottis in the back of the throat. Tapeworms could cause headaches, seizures, meningitis, and dementia. Not a surprise. So medical practice has evolved greatly during the 18th and primarily 19th century. Looking back, we wonder how people survived, but they did. And the odd treatments of the past did pave the way for modern treatments today. I know I ran over, but I've got some questions here. So Paula, do you want to handle the questions or should I?
That's up to you, whatever you prefer. I can read them to you if you'd like. There's a lot of comments more than questions so far, although I'm sure once I start talking, the questions will roll in. Let's see, go back to the very beginning.
By the way, I can say I did my master's thesis on operating on nothing compared with operating on everything. Comparison of Satterley Hospital, Union Satterley Hospital with Confederate Chimborazo Hospital. Satterley Hospital was a receiving hospital. In other words, the Gettysburg wounded, for example, would be stabilized at Gettysburg and then transported by train to Philadelphia. So they were at Satterley convalescing. And Satterley had everything. They had all the food they could eat, all the whiskey they could drink. Survival rate was 89%. Chimborazo Hospital, we talk about Confederates not having anything. Chimborazo was an acute care hospital. They came straight from the battlefield around Richmond, right to Chimborazo. If they didn't have Chimborazo, again, they had very little food. Dr. James McCall was the medical director, and he did a real good job keeping that hospital running. And Dr. Samuel Preston Moore was the only cabinet member in Jefferson Davis's Confederate cabinet that was there from day one until the end. Secretary of War was a revolving door, but he was the Confederate Surgeon General. He was there the entire war, did a fantastic job with the medical department. Thing is, Chimborazo Hospital, Satterley, 89% survival rate. Chimborazo Hospital, operating on a shoestring, 89% survival rate. How did they do it? You'd have to read my thesis. The first resection of his shoulder was done at Chimborazo Hospital. Something I didn't mention, and this was common in all Confederate hospitals, they could not get catgut to sew up surgical procedures. Catgut was used by the Union Army. Thing is, catgut gets infected. Because they couldn't get catgut, the Confederate surgeons would boil horsehair to soften it up, and by boiling it, they sterilized it. There were a lot less surgical infections on the Confederate side because they boiled horsehair and used that instead of catgut. They couldn't get calomel, which I said calomel killed a lot of soldiers. They couldn't get calomel, so they came up with other things instead. So that decreased the number of people dying. But percentage-wise, the survival rate was the same at the two largest hospitals on both sides of the war.
Interesting.
Again,
Jane
you'll have to read my thesis.
Yes. Is that available online somewhere?
Yes, it's available for $10,000 each, and I'll for an autographed copy, I'll do it for 15. No, we could talk about that later. Okay. I actually have a presentation on my thesis.
There's let me see. I don't know if he's still in the audience, but Dr. Michael Lacapo has done, I think, a lecture on using theses and dissertations for genealogical purposes. So maybe he can help us find it if you can. All right, on to the chat box. So we have
Please.
Jane Power posted opportunities to join lineage societies to honor your ancestors who were in the medical community. She gave several links, so you can scroll back up for that. Sherry said that etch, which I assume is an abbreviation, was wonderful for coughs. Elixir of turpin hydrate.
Yeah, ETHC. Elixir turpin hydrate with codeine. ETHC. Yeah.
Elixir of turpin hydrate was the best cough syrup. Reminded me of gin.
I'll tell you, you had to mix it with something because it really was awful. It was like drinking turpentine.
Oh my.
It caused liver problems. That's why it was taken off the market.
Someone said Piney, still made in Pink Hill, North Carolina. It's a spirit of turpentine. So there you go.
There you go.
When I had my tonsils,
you can still get turpentine. You can still get turpentine.
Yes, that you can. When I had my tonsils out, I was given ether. My mother took digitalis for CHF and chronic AFib. And also said barber poles were a symbol for bloodletting, as you pointed out, the red stripe. I remember the stripes found on barber poles. Did George Washington inoculate his troops with cowpox or smallpox?
No, Hugh Mercer did until he was killed at the Battle of Princeton in 1777. But other physicians picked up on that, but Hugh Mercer is the one that really pushed that.
Okay. Did your comments about medical schools apply to England and Scotland also? My wife's ancestor, Dr. McCaw, Richmond area, went to medical school in Edinburgh.
Well, Edinburgh Edinburgh was one of the best medical schools at the time in Edinburgh, Scotland. And I hope they're not referring to James McCall, because James McCall went to Boston for medical school and then came back down to Richmond to practice.
See if he mentioned the name. I think he mentioned it later. Oh, okay. Hold on just one moment. Sorry, I scrolled up and then I lost my place. There was a great deal of grave robbing in Richmond, Virginia. Here's an interesting treatment found written in a relative's ledger in 1791. A shower, SHOAR, remedy for the bite of a snake. Oh, I guess it's probably shore. Take an equally quantity of salts and gunpowder and mix it up with the spittle of parson bits and apply it on the part of the snake bite, which will make a certain sour, something like that.
Probably make a poultice. Yeah.
Yes. The butchering art by oh, sorry, go ahead.
I was going to say, I don't know if I'd want to do that today, but anyway.
The butchering art by Lindsay Fitzharris about Lister is very good. Some joking about women's ills. What about men's ills?
Well, again, we're the stronger sex, supposedly. Boy, is that a fallacy.
The National Museum of Civil War Medicine in Frederick, Maryland is fascinating.
Outstanding. I've been there many, many times. Matter of fact, I have a couple of contributions up there.
Oh. And then Donna pointed out that the Chimborazo Medical Museum at Chimborazo Park, 32nd and Broad Street in Richmond, and she posts a link to that.
It's an outstanding museum. And again, I spent a lot of time there when I was working on my thesis. It's really, really good.
Indeed.
Just don't go up to Chimborazo Hill at night. It's a major drug dealing area. It's not a good place to be at night.
My Confederate great-great-grandfather was a patient at Chimborazo. He survived. Another great uncle was at Winder, where he died at Winder Hospital, age 21.
There were over 100 hospitals in Richmond. Some of them treated 1820 patients. They were mainly state hospitals. If you were an Alabama soldier and was wounded, you go to the Alabama hospital. Chimborazo didn't matter. They just brought him in regardless.
And it sounds like that was Dr. James Brown McCaw is who the Dr. McCaw mentioned earlier was referring to.
He didn't go to Edinburgh, though. He went to, actually, it was New York. He went to medical school in New York City.
Okay. A good website on Civil War Richmond is www.mdgorman.com.
Yeah, that's Mike Gorman. He's a friend of mine. He's with the National Park Service and puts in a lot of time at Chimborazo. Very, very knowledgeable.
Lots of very interesting information. Thanks for a great presentation. Well, excellent presentation from a critical respiratory therapist. Great information. How do we get a copy of the paper? So Doug had the same thought I did, so we will talk about that later. Terrific presentation. We have mostly Confederate ancestors who were in almost all Virginia wartime hospitals. I still have a pill ruler that we used during our reenactment days.
Yeah, they're hard to come by, but they're out there. I've got one.
Mark Lowe wants to know, were there significant changes to medical training before the Civil War?
Before the Civil War, it depended on the school. Case in point, Hunter Holmes McGuire, which I'm sure many of you heard of from Winchester. His father was a physician, opened up a medical school. He attended the medical school there, went 1 year and realized he didn't know enough. Ended up going to Thomas Jefferson University in Philadelphia and was there in October of 1859 when the John Brown raid occurred. And he was instrumental in rounding up 100 of the students. I was actually 104 from University of Pennsylvania and from Thomas Jefferson University, and brought them south. When they got to Richmond, the Governor Wise actually said, if you want to stay and go to MCV, which was the Egyptian building, you can go. If you got 1 year left, if you got 3 years left, you can go there free. And of the 195, I think, 96 stayed. 2 ended up going to the Medical University of South Carolina, and 2 ended up going to Tulane. The the only other medical schools that were open at that time. MCV was the only medical school that stayed open the entire war. So what I'm saying is McGuire had 2 medical degrees.
Okay. What is... go ahead.
Let me finish. As far as curriculum, the curriculum in the big cities were 4 years, 3 years of actual academic work and 1 year of actual hands-on. So that, again, was prominent in Philadelphia, Boston, New York, Richmond, Charleston, New Orleans, Atlanta. But other medical schools, no, a year, 2 years. It really depended on the faculty and the availability of faculty.
Makes perfect sense.
Really wasn't standardized until the 1870s.
I'd imagine the Civil War and its medicine probably prompted that a little bit, or sped that up a little bit.
Something I didn't mention, and I should have. This totally eluded me. I am sorry. If you look at records of asylums and mental health facilities, people that were admitted in the 1880s and 1890s, about 80% of them were women. The reason being they had tertiary syphilis. The soldiers came back from the war. They'd been infected because brothels at that time were very common and very well used. And they infected their wives and girlfriends, and tertiary syphilis. The end result is total dementia. And if you look at the 80s, 1890s statistics for mental facility admissions, it's women. And it was tertiary syphilis primarily.
With the exception of my great-great-uncle.
Oh, that's good to know.
What is snake oil?
Snake oil is applied to anything that is sold as a remedy for everything. And some of the snake oils out there were, again, going back to Faricum. It was good for diphtheria. It was good for rheumatism. It was good for this, that, tick bites. Probably good for getting out stains too, if you really wanted to push it. So it was just a catch-all for, it was good for everything.
Okay. James Morrison of Kentucky was one of the largest growers of hemp. Was Washington growing cannabis for medical purposes as well as hemp for rope?
He said it was for rope, but he didn't turn out that much rope. So I'll just leave it at that.
There you go. Huguenot Springs in Powhatan County was the convalescent hospital for Richmond hospitals. Could accommodate up to 350 patients.
I have a relative buried there. J.R. Dula he was wounded at the Battle of Fredericksburg, was taken to Huguenot Springs where he died, and he's one of the 250 Confederates buried in the trench grave there at Huguenot Springs Confederate Cemetery. So I know it well. Matter of fact, Robert E. Lee visited that hospital a couple of times. It was a very, very good hospital right near the hot springs.
Thank you, Dr. Marsh, for trying to correct Channel 12's pronunciation of fentanyl. It makes me crazy every time I hear it.
Oh, it drives me nuts. My wife says, calm down, calm down. I go, what do you mean calm down? They're saying it wrong.
Any recommendations on how I might research where an ancestor who was a doctor in 1849 in Abingdon, Virginia, might have received medical training or apprenticeship, if any?
Well, there's certainly the Hampden University, which became MCV, roster, and you could search those and just look. Was it class of 1849? They say?
Yes. Well, it was a doctor in 1849, so I would imagine it went a little before that.
Yeah, look in the 1840s at Hampden University, and also look at the database for MCV. I think MCV only goes back to 1900. The book I've got, I think, only goes back to 1900.
Okay. Dr. Jim McCall's grandfather was the one who went to Edinburgh.
There you go. There you go. Yeah, because Jim McCall did go to New York and then ended up down here. Married a Southern girl, and he and she are both buried in Hollywood Cemetery, not far from President's Circle.
For anyone interested in Richmond grave robbing for MCV, check out the East Marshall Street Well Project at VCU. Being the medical school in the Confederate capital, African and African American individuals were grave robbed. I interned on the project for a while, and she gave a link. I'm currently watching from Edinburgh right now, doing an abroad semester at the University of Edinburgh.
I love that. I love that city. Fantastic.
There's a great article on grave robbing in Richmond in the Virginia Historical Society's magazine. I've written a history of Huguenot Springs and its role as a hospital during the Civil War. Neil, if you want to post a link to either of those, that would be great. And good. Mary says, had a relative who drove an ambulance during the Civil War. Was any medical treatment offered by the ambulances, or were they just transportation?
Well, on the southern side, they were primarily African Americans that volunteered to serve and were made drivers, wagoneers, suppliers. They would stock supplies and things like that. They were not allowed to treat patients. They were just there to transport them. And most of the time they were in 2- and 4-wheeled vehicles with no springs. The Gettysburg campaign, the wounded wagon train, the wagon train of the wounded soldiers coming back from Gettysburg was 17 miles long. And if you go to Winchester, Mount Hebron Cemetery, right near the grave of Turner Ashby, a Confederate cavalryman who's very famous, right near him is probably 3,000 to 4,000 graves buried by state of those that came back from Gettysburg and died in the Winchester hospitals. It was agonizing for many of them. And unfortunately, they were trying to make room for more wounded. If somebody died in one of the wagons, they left them by the roadside. In the history of the surgical and medical history of the War of the Rebellion, they talked about coming through Newcastle and a couple of other towns, Fairfield, coming into Maryland from Pennsylvania and finding Confederate bodies, soldiers' bodies on sides of the road. It was pretty grisly.
Sounds like it. And on that note, that's all we have in the chat box for questions.
Well, I got to leave you, as a pharmacist and a comedian, sort of, I've got to leave you with one more slide if I can get to it. There you go. Pharmacist is saying to a woman, it's a mood elevator. Each capsule contains 10 milligrams of Zippity and 5 of Doodah. Got to end on a happy note, right?
There we go. I did get a follow-up to that last question. Surgical history of what?
The medical and surgical history of the War of the Rebellion. It's available online, but it's one of those, when you start to download it, go get a cup of coffee or a cup of tea, because it's going to be a while. It's big. It's massive. But I'll tell you what, the illustrations and the discussions are just fascinating. And again, the surgical side, the medical side of the Civil War is one that's not talked up all that much. It's battles and tactics and all of that. Again, how many people knew that surgeons got together before a battle and hey, do you have enough chloroform? Do you have enough bandages? Do you have this? Do you have that? It's in the records.
Posted a link. If you Google it, you can find it at other locations as well, but that has some information as well.
Well, considering I'm a Southerner, I'll leave you with this.
Okay.
When Sherman and his Union troops got to Stone Mountain after coming through Atlanta and burning it, there was 60,000 Yankees, and there was one Confederate on the top of Stone Mountain. And the Confederates going, come on, Yankees, come on, come get me, come on. So Sherman looks at it and he says to his sergeant, take a squad up there, get rid of that guy. Well, squad goes up, they hear a lot of shooting, nobody comes back. Rep comes out, standing on the rock, come on, Yankees, come get me. Sherman says to a lieutenant, take a platoon up there and get rid of this guy. Platoon goes up there, they hear a lot of shooting, nobody comes back. The Confederate comes out, come on, Yankees, come get me. So Sherman says to a captain, take a company up there, 100 men, get rid of that guy. Company goes up, they hear a bunch of shooting. One soldier comes back, bleeding from his scalp, bandage around his head, broken musket. He's limping. Sherman says, "Come here, son." He says, "Tell me what happened." He said, "Sir, it was an ambush. There were two of them."
I have heard that so many times.
I can get away with that being down here. So.
As a northerner living in Georgia for a while.
Oh, you can't even say the name Sherman down there.
Nope. I also couldn't give my grandfather's, my mother's maiden name was Stowe.
What I find interesting is Milledgeville was the capital of Georgia at that time. It wasn't Atlanta. And if you drive from Atlanta to Milledgeville, you can still see scars where his army came through there.
Yeah. Well,
200 miles long and 60 miles wide.
I was living in Savannah, where I was repeatedly told that Savannah was given to Lincoln for a Christmas present.
For a Christmas present, 1864. Mm-hmm. Well, Jimmy Carter, again, a good Southerner, since you mentioned Georgia, Jimmy Carter, after he was president, went to Cannes for the Cannes Film Festival. And he came out and they said, "So, Mr. President, what did you think of the movie?" He said, "I thought the movie was good," but he goes, "You know, being from the South, our favorite movie is Gone with the Wind." But he says, "I think in the South, we saw a different version than everybody else." He said, "I really like the part of the burning of Schenectady, New York, just before Grant surrendered to Robert E. Lee."
Yeah.
He did have some humor. He did have some humor.
Well, I'm attending from Auburn, Washington, so I was interested in your statement about the quinine.
Cinchona bark, yep. It comes from up there. Also, you might have heard of a cancer drug called paclitaxel or Taxol. Mm-hmm. It comes from the Pacific Northwest because it comes from yew trees, and They only grow up in the Pacific Northwest. Now, here's an interesting fact. Robin Hood. There wasn't one Robin Hood, but several Robin Hoods. But one Robin Hood, who was an excellent archer, died of yew poisoning because they used to use the yew tree to make the arrows. And he impaled himself with a yew shaft and got infected and died. Little history when it comes to the yew tree.
It's very interesting.
And again, that's where paclitaxel comes from. 25 trees to make a gram of the drug.
Wow.
Well, thank you very much.
Oh, you're very welcome. I appreciate the opportunity.
And thank you to GRIVA for expanding and allowing those of us in other parts of the country to attend. We've also experienced that with COVID. We've opened up and have members from all over the country. In fact, I noticed that one of our members was even in attendance here. She lives in Australia.
Wow.
Wow.
Yes.
So, do love the virtual format for that sort of thing. I know that lots of people wish that they could meet in person, and there's definitely benefit to that, but there's also, I think, benefit to this as well. So.
Oh, most definitely.
And Louie could definitely, my cat Louie could definitely not be sitting in my lap if we were doing this in person. I don't think so.
Well, my cat unfortunately passed away a few months ago, but he was one who would always, everybody watched for him because he would usually show up about 10 minutes before the end of the session, and his tail would go across the, well, it's about time to wind up.
Yep.
Well, my cat was doing the same thing. My cat kept coming in and going in between my legs, sitting in the chair like, "Are you done
Dad,
yet? Come
it's
on."
time. Well, on that note, we shall all go tend to our animals or to whichever. You had a few more. Thanks for all the great information comments in the chat box. So I will leave it with that. We thank you very much for the great information, and thanks to everyone for
let me
attending.
also throw out, Paul, if somebody
Please.
has some other questions that they want to forward it to GRIVA, I guess, and then
Okay.
forward it to me, I'd be happy
Okay.
to address anything else that comes up.
Sounds good.
Okay. All right.
All right.
We all take
Thank you.
care. Have a good spring.
Bye-bye.
Bye-bye.
Bye.